Excess alcohol consumption damages and eventually kills liver cells by causing oxidative stress. This occurs when the liver is forced to work overtime to process heavy amounts of alcohol. This sets off a series of chemical reactions that can damage liver cells. If alcohol abuse continues, the result may be severe inflammation of the liver cells. In a desperate attempt to preserve itself, the liver will develop scar tissue to halt the killing of its cells. This is called cirrhosis. Excessive alcohol use can also damage the large intestine. The result is a flood of toxins released that find their way back into the liver. The result? More scarring and increased inflammation. Chronic hepatitis, or hepatitis C, is a silent killer that may lie dormant for decades before any symptoms manifest. Left untreated, hepatitis C can lead to cirrhosis and eventually liver cancer. If you were born between 1946 and 1964, you were advised to be tested for this insidious killer. The fatty liver disease, also called steatosis, is on the rise. As with hepatitis, there may be no symptoms for decades. Then symptoms arise, such as an enlarged liver, fatigue, and pain in the upper right abdominal area. This condition is defined as a buildup of fat in the liver. Like all organs, every liver has at least a small amount of fat, which is needed for the liver to function at a healthy level. However, when the level of fat in the liver accumulates to the 5 to 10% level, this may indicate fatty liver disease. There are two types of fatty liver disease: alcoholic liver disease, ALD, and non-alcoholic fatty liver disease, NAFLD. Although there is some uncertainty about the causes of fatty liver disease, the condition has been associated with being overweight, bad eating habits, heredity, developing insulin resistance, having elevated blood sugar levels, and having high fat concentrations in the blood, in particular triglycerides. As with other liver afflictions, fatty liver disease can eventually lead to cirrhosis and liver cancer. Additionally, the best way to check your liver's function is a blood test. If your alanine transaminase, ALT, and aspartate transaminase, AST, levels are elevated beyond the normal range, this may indicate damage or inflammation to your liver. Don't ignore this. Check with your doctor immediately. If your level of triglycerides, a type of fat that provides a vital function, in your blood is greater than 250 on a standard blood lipid profile, consider this a warning signal that fatty liver disease may be looming on your horizon. Liver disease is serious, deadly serious. Here are some facts and numbers to consider. Annually, more than 100,000 patients are hospitalized and diagnosed with chronic liver disease or cirrhosis. According to the Center for Disease Control, or CDC, in 2014, 38,170 deaths occurred in America as a result of liver disease. This makes liver disorders the 12th leading cause of death in the USA. Among the baby boomer generation, born between 1946 and 1964, it is number 4 in mortality, right behind cancer, stroke, and heart disease.